Well, a lot of people in our country have coverage. It's sometimes very expensive, but we pay way more for health care in this country than any other nation, like 1.5 times more. We don't get better outcomes. In some cases, we get worse outcomes. We have a bunch of people who don't have health insurance today, about 40 million plus. And today, 14,000 people who had health care insurance yesterday will go to bed today. They won't have it. And we have big companies like GM and like Chrysler and little companies too, that are finding it hard to compete with their competitors around the world because of the cost of health insurance. So the idea of doing nothing and just say, well, we're going to give up because this is hard, that's not a very good option. We've got too much riding on this, and we need to see it through, and at the end of the day, figure out, and we know we have really good ideas on how to reduce the cost of health care, slow the growth of health care costs, and actually improve outcomes. And with the money that we save, to extend coverage to people who don't have it. So that's what we should do. As far as who will be helped by the enactment of this legislation, I think among the people who will be helped are folks who already have health insurance. We're lucky to have it. But we're paying about an extra $1,000 a year to cover people who don't have it, who end up in our emergency rooms and our hospitals for uncompensated care. We pay for that. The rest of us pay for that. So we'll be helped. Those of us who've seen our healthcare costs rise, I just talked to an employer today. They said their healthcare costs were going to go up next year by like 18% on top of about 16% last year. And we're going to help folks like that because we're going to give them better choices, a lot more choices, and let competition work to bring down the cost of healthcare for a whole lot of families, a whole lot of businesses, and for individuals. So they'll be helped. And I think we're going to be helped because we're going to get better outcomes. We actually know some ways, and a lot of ways to improve outcomes, and a lot of that will flow from this legislation. So there are any number of folks in our country, from people without coverage to who don't have it today, are going to be helped, but a lot of others as well. Well, I know people think this has been an endless debate. Actually, the debate goes back not just for a year. The debate goes back to when Harry Truman was president. He first called for addressing the need for quality health care for just about everybody in our country. My hope is that the Senate will pass legislation, comprehensive legislation, that focuses on improving outcomes, reducing the growth of cost, extending coverage to people who don't have it, and we do that by Christmas. We then figure out how to compromise our bill with the House bill, and I hope they will largely accept what we are going to pass. And then the president, I expect, would sign that legislation before the end of January. Almost immediately, among the things that will happen is the inability of people to get insurance coverage if they have pre-existing conditions. That will go away. We're going to, again, improve the quality of, reduce the cost of prescription drug medicines for senior citizens who use the Medicare prescription drug program. The idea that folks can literally have their insurance cut off is going to, because the cost of their coverage has gone up, that will go away. Those are just some of the things that will change almost immediately. And in the long run, there'll be other things to come along. But one other I would mention for people who have children that maybe are still in school or they're out looking for a job, but they don't have health care coverage. They'll be covered by their parents' health insurance up until age 26. So for a lot of families with kids that are coming up out of school, that's going to be a help as well. And that will happen almost right away.